Hello, my name is Laura Hattersley and this is episode 14 of the Kicking CASK podcast. And today I'm going to talk a little bit about the Aspire Biosciences Workshop, which I attended a few weeks ago now. It's basically like a speed dating workshop between rare disease organisations and pharmaceutical or biotech companies. So it was something like a 10-page application process plus an interview to get onto this, and we had to show that we understood our disease as much as possible, obviously, and what kind of models were available out there, what kind of research we have funded and instigated, and basically kind of proving ourselves that we are a professional organisation and we have a community of scientists and a community of patients and their caregivers that support us, and so that if a pharmaceutical company or a biotech company did decide to partner with us, that they would have no problems in progressing things forward and they would have the support they need. So we were very excited to find out that we had been accepted onto the workshop, and part of the process is you have to have in attendance at least one scientific advisor with you. So you can't just go as a patient advocate. So we were very lucky. We actually had two scientific advisors, which if anybody's listening to this from another rare disease, I would definitely advise having more than one, and ones with like very different expertise. So we had a Professor Tabuchi who flew all the way over for Japan literally just for the day. He came in the evening before and flew out the next day. And he is a specialist in CASK. He's been studying CASK pretty much as long as anybody has. He has his own mouse models that he works on. He's looking into drugs now to treat the cerebellar degeneration that is found. And so he knows a lot about the molecular pathways of CASK and obviously his own work as well. And we also had Dr. Sam Amin, who is our clinical advisor, and he works with the NHS here in the UK, and he is also an expert in diseases very similar to CASK, and obviously is now getting very familiar with CASK-disorders, and he's also an expert in leading clinical trials. He leads a lot of clinical trials over here, and that's the kind of team that they want to see. So we had the team and we all turned up a week last Wednesday, and I had to give a presentation all about CASK. It could only be 5 minutes, which was the hardest thing, because I could talk forever about the CASK gene and its related disorders, but we had to keep it really concise. So I think that was my first presentation in front of biotech and pharmaceutical companies. And then we had 12 minutes to talk to each organisation, each company in turn, and it was, if you've ever been speed dating, it was just like that. So the rare disease organisations, and these were all just neurological rare disease organisations, they sat on the table, and the biotech and pharma companies, they rotate around. So we literally just had 12 minutes to kind of introduce ourselves. We'd already been in conversations with any we were interested in beforehand. We'd been given their contact details, and to kind of cut to the chase, I guess the outcome that everybody wants is to get a partnership and support from one of these organisations. Obviously, that is kind of the pinnacle of what you're hoping for. I guess the worst outcome is that nobody's actually interested in your disease. And I would say within that range, we came out near the top. So it was extremely successful. There was some not disappointments, because I'd kind of recognised this was going to happen. So for example, Alexion were there, which is the rare disease arm of AstraZeneca, and everybody has heard of AstraZeneca. We'd already been in touch with Alexion a few years ago, and yes, not surprisingly, they are not interested in CASK disorders. So, that's not necessarily a bad thing. We now have, we've been told this twice now, so we know not to keep looking at them as a potential avenue. It was a bit disappointing that we also had some gene therapy pharmaceutical companies who also told us that we were just too rare for them, which I was quite surprised about, because most of these neurological gene therapies are for rare diseases, but they don't really want ultra rare like CASK disorders. So that was disappointing, but again, very useful because we won't waste our time. And however, just to tell you the actual positive outcomes of it, we will be partnering with a company who have a potential therapeutic. Well, they have a therapeutic that could potentially help our children, and so that is very exciting. And Dr. Tabuchi is fully on board with assisting with this, and Dr. Amin also was supportive and thinks this is a really good opportunity for us. So I guess it was very successful for CASK-disorders, which is amazing. And there was a few other things as well. So we may be, this is all dependent on funding, which I'll talk about in a minute, but there's also some epilepsy research that might be interesting for us and could help our epilepsy, but we need to invest in some animal models with that to be able to make the most of that. And also there's a company that was looking at the mitochondria, and they've got a really interesting therapeutic, but again we need to understand more about the mitochondrial impact to our rare disorder. So it was extremely informative, extremely useful, and I would say there was a very positive outcome. So I'd just like to thank our advisors for coming. So on to the next thing. So some very exciting news is that we have a patient database in development, and this is being part funded by CASK Research. We don't know whether this will be UK or global as yet. We would like it to be global, but that all depends on the liability that comes along with this, because obviously this can't just be run by a charity. So this is actually being run by the University of Bristol and the NHS. So Bristol, I believe it'll be Bristol or the NHS. Anyway, one of them would be liable if there was any data leaks or anything like that, and it's dependent on whether they want to be liable for that kind of thing. So we're looking into that. However, that is going ahead, and just to allay any fears, because I'm sure people don't want to think they're going to have to input data into another registry. This isn't going to be that. So, it's going to be that, but only slightly. So obviously I was a person that initiated the RareX database and got that going globally, and I don't want to replicate that because there is absolutely no need. I fully believe in the RareX patient database, and the data they collect is excellent. But it is a specific thing. So what it is patient reported data. That's what it collects. What we don't have here in the UK, and generally globally, is clinician reported data, and also some of the surveys from RareX don't collect the exact data that we need. So what this new patient database is going to be collecting specific data that we can't get on RareX, or isn't might be amongst a huge survey of data that we're not really looking for, but we just want to know, for example, how many milligrams of your epilepsy medicine are you on, for example, which isn't actually collected at the moment on RareX, and if it is, it would be within a huge other survey that people might not want to do. And also the exact genetic information, which again, obviously many people have uploaded onto RareX, but I know here in the UK it's very, very difficult to get the genetic report. So here we would just go via the NHS, and the clinicians would submit all that information. So we need to ensure that clinicians are on board with this, because they're going to be submitting most of the information, and then the patients also need to be supportive of it, because they might be asked to submit a little bit of information, but it won't be anything like RareX, and it's not meant to duplicate RareX. So that is happening, and I'll keep talking about that. The next thing I want to talk about is the funding. So I was having a look at our bank account and all the different avenues that we get the revenue in, and it has been an extremely slow year of donations. So I think I counted about 11 donations from about 11 different people, and that is it from the year to date. That does exclude people who've donated to bigger fundraisers. So, for example, we just had the Open Gardens here, which raised over £5,000. So that excludes obviously all the people that contributed to that. And also Joanne and Alice are doing a Just Giving campaign for us at the moment, where they're going to run an ultra marathon actually. And so I haven't obviously included all the people that have donated to them. But in terms of regular giving and one-off donations that aren't associated with a fundraising campaign, we've had about 11 people donate. So that's obviously really disappointing, because I feel like we're finally at the stage where we're getting, we have the teams available. They just need a little bit of money, and we never ask for loads and loads of money. We just like to seed fund research so that they can get going, get the data, and then apply for larger funding. So yeah, I will be pretty blunt. It is quite demoralising looking at the bank account. So if anybody can think of any fundraising ideas, we have very few fundraisers happening at the moment for us, very few live ones. I think maybe only one. Thank you to the people who have done birthday fundraisers. Probably over 50% of them get nothing, but then sometimes you'll get one that raises over £100 or €100. So, that it's worth doing, and never feel bad if, you get nothing, but you never know what you'll get. And if you tell your story and tell people about everything this charity is doing and all the possible avenues, then, people will want to donate. So it's just about getting the information out there. So just in case you kind of wonder, well, what's the point of donating to CASK Research, and what kind of research could help my child? Maybe, gene therapy isn't the thing for you. Like, we all know it's going to be years and years and years for anything like that to come about, and we're not sure at the age that it'll actually be useful. So I'm just going to tell you about some other things that we would really, really like to fund right now, but we do not have the funding, so it is not going to happen. We have a scientist already. We have two scientists actually at two different universities looking at the mitochondrial aspect of CASK disorders. They're still studying it, but they do it in their spare time. They don't have any extra funding. It would be amazing to fund that, because we talk to pharmaceutical companies who are investing in therapeutics for this, but we'll never be able to try them on CASK if we don't know that CASK has a mitochondrial aspect to it. The other thing is this, the company that we have partnered with from the Aspire Biosciences, they are going to give us their therapeutic for free. However, Dr. Tabucci or whoever ends up testing the drug on their mice, that costs money to keep the mice alive and to obviously fund the researcher whilst they're doing those tests. So I know that they will be applying for funding, but that takes time and isn't 100%. So we'd love to be able to help with that kind of thing. As I said, the UK database, which might be global and is really essential. I'll talk another time about why it's so essential. But we're paying for that at the moment. It's minimal money. But, we need to have that maintained long term, because this is a forever database, keeping data of the patients and new patients. And that is minimal money. There was some epilepsy. There's epilepsy trials coming up and new epilepsy drugs, but we really need to be able to test them on an epilepsy model. I have a scientist waiting to create an epilepsy model for us. And again, that wouldn't cost that much money because it isn't a mouse model, but we don't have the funding for it. So that is just an example of some of the things that I'd really like to be able to do. I'm not floundering in the dark, looking for ideas, looking for scientists. We have all the scientists. I have very good relationships with the scientists. Every person I've mentioned just now, I didn't mention them by name, but I have actually met in person all those scientists that are waiting. So we just do need more support from the community. And I know it's a big ask, but that's just the reality. Things aren't going to happen, or they're going to happen really, really slowly, and children are going to be suffering whilst we're waiting. So following on from that, we do have the global CASK Race for Research, which is being supported by all the members of the CASK Coalition. So you can do it from many countries. You can do it from any country, but 4 different countries have have their bank accounts in those countries. And the link actually wasn't working if you went on the global page, so it is now working. this is just a platform for you to easily fundraise, and it's quite fun because you can choose to do any length of race you want, 5k, whatever. It's really like we do it as a fun run, and you can see how much money you're raising compared to other teams, so it just gives it that like competitive edge. And so that's all there, but we have a whole page of fundraising ideas. A fun run might be not your idea of fun, so maybe you want to do a coffee morning, but we do need support. And lastly is the UK Family Meetup that we've got a date for now, so please check your inbox if you don't know anything about this, and you don't even need to be in the UK, so if you're happy to fly over or have family here, it's in September. I can't remember the date offhand. If you don't know anything about this, send me an email at laura@caskresearch.org asking for more information. And it's open to anybody with a CASK disorder and their families. And we're going to the same place as last time because it's fairly central, and there is lots to do for our children and also for the siblings, and it's just a nice opportunity to catch up. I think we have 8 people who've registered so far, so it's going really well. We normally have about 9, so this time maybe we will break our record of number of families attending. So please fill it in the registration form if you want to but haven't already, because it's good to get these things sorted in advance. Anyway, that's a lot of chatting from me. Thank you for listening, and I will give you another update shortly.